In previous practices, I've had electronic medical records that we were transferring to from a paper chart. When I started my practice now, I started with waiting room solutions because I wanted something that was attainable to get information from home. It was quite important to me with my type of practice to be able to do that on the weekends. So previously had some very cumbersome electronic medical records that you had to sign in and have a secure, I guess, Citrix or whatnot to have access to it. This is so much easier because even if I'm at someone's home, I can pull it up on their computer. So it's very nice from that aspect. The workflow is, I think, fairly similar to having paper charts in that patients come in and you check them in and the nurse takes their information. I think I'm probably a bit behind the times that I don't put a lot of the information in while I'm seeing the patient because I just tend to like to sit at my desk with them and talk with them without typing. But the nice thing is that at the end of that visit I can put that information in, and I feel that I capture the charges and accurately reflect what the visit was much more than previously with paper charts or with other electronic medical records. When I was looking for an EMR, I was looking for a web-based program so that I would have 24/7 access. Also looking for something that obviously wasn't too expensive. I didn't want to have my own servers. I wanted the security to be maintained because I'm not that high-tech of a person. I also probably looked at 10 or 15 different EMRs, pretty much based initially on price and what they had to offer, and then really looked at kind of the ease of doing billing, scheduling, everything all in one, rather than getting different components of a program. I liked Waiting Room Solutions initially most because of the web-based part, but now I think it's nice from the standpoint that I have electronic capability from obviously anywhere, but also that the patients can email the patient portal and the billing, and that it's all tied in together. That was probably one of the more important things because I felt that I didn't have to try to transfer that information to a billing company, nor did I need to try to keep things in separate locations. So that was probably the biggest influence, and I thought it was a reasonable cost for what was being offered. I think patients really like it because they like being able to update their medication lists, being able to kind of make their clipboard, their history, because I tell them to do that if they're going to see other physicians. Also, they really like it for prescription refills, requesting appointments, updating me with information. So a lot of emails come in through there. They like to let me know too that they got their reminder for their appointment the next day. The fax queue has significantly decreased the amount of paper that we're using and ink, and also it's just increased efficiency in that we're not grabbing the paper chart, clipping it to it, scanning it in, etc. So it has significantly improved the workflow, as well as, I think, the accuracy of making sure things are put into the right chart. I have a local biller who, she and I had actually checked out Waiting Room Solutions together, and so she's local, but she obviously uses the Waiting Room Solution billing program. And so what I particularly like is that I put in the charges at the end of the day, as I do my note, but also I can email her and say, I don't know which code to use for this, or please note that this might need to be changed. And so it's very flawless and seamless without phone calls and faxes. It works very well. We just had the training online. When I started, I guess I did the training back in June, 4.5 years ago, before I started. For the basics, it was good because you don't know, you can do all the training in the world until you use the program. You you just can't remember all the details. So I think a lot of the training that you do a lot of it as time goes on. Right now I'm working on some training with Risa next week on the lab fax document queue. So it's kind of ongoing. Oh, very good. If you log a ticket, they'll get back with you. I don't think I have any complaints. Oh, I think a lot of the updates they've done in the last couple of years have been very useful. Now I can't remember all of them, but I remember just recently some in the medication queue were quite useful. So I do appreciate those updates and hope that they'll continue to do that. I've made some suggestions, so we'll see if they come through with those, but I'm sure it's hard to please everybody all the time, but I think a lot of the updates really probably do help a lot of the different types of providers. Probably the 24/7 access from home, and that I can go home and see my dogs and work on my computer and finish everything up there. Leslie is at the front. She obviously does a lot of the scheduling. She also very much loves the electronic faxing of documents because she kind of takes care of the referrals and things. And then Gail is the nurse who is doing the prescription refills, the prescription phone notes, tasks, and whatnot. So, I think there's a learning curve with a lot of that, and they're really stepping up to the plate, and now we're getting into the faxing of labs and whatnot, and they really like it because it improves workflow when they're not having to pull paper charts. Well, I think you have to obviously look at price, but you have to look at the company and how long they'll be there, because trying to switch would be a huge disaster. So staying with someone who's well certified, well supported, that's making appropriate updates, staying up with the what is needed for billing and coding and whatnot. But also that you need to have something that's accessible. We're a very mobile world these days, and I think that having something that's web-based is very important, and something that is all-inclusive. So I think you can't just get some cheap program that just documents your notes. You might as well not invest in that. I think you have to have something that is very comprehensive, which Waiting Room Solutions is. Yeah, I remember thinking that was important, when I first started, and I do think that's important. I think that they will understand better what we're kind of going through and how hard it is to see patients and document everything in a given day and make sure the billing's done correctly. In the ideal world, you'd have somebody following you around doing all of this all day, but that's not going to happen, so you have to have a system that's going to work. And I really think only people who do it every day understand how that needs to be done. Well, I think that having the patients involved in their looking at their medical record. When I do their annual physicals, we go through everything. We put everything on their problem list and in their history, and I want them to look at that. I want them to participate in it, and keeping track of all their healthcare maintenance, and I think it just works well for them to participate with me. I think the nice thing about it, I'm generally a very organized person, and I feel as if it helps kind of keep up the details. I remember having old paper charts with medication lists, and it was never correct. And, you just hurried up and refilled something and you didn't put it in anywhere. I think the way that you keep track of the important things, which are medications and where they've gone to and who did it and when, it's just so much easier. I can't imagine not doing it this way now.